Okay, let's get started. Well, thank you everyone for joining us. My name is James Watson, and I'm a research manager here at ReachNexus. And we're super excited to share this HIV stigma initiative with you. And it's titled Positive Actions Breaking HIV Stigma. And this work is really a manifestation of our team's vision that when people living with HIV are in leadership positions, even small actions addressing HIV stigma have the potential to make significant change. But before we move forward, I'd like to introduce you to Dave Miller. Dave is a Mi'kmaq HIV activist in Atlantic Canada and a research coordinator here with us at ReachNexus. And he's also working with Healing Our Nations as a community health educator in over 30 Atlantic First Nations communities. And we've been fortunate enough to have Dave involved with this project from the very beginning as part of our community advisory group, and he's offered to open today's webinar in a good way. So welcome, Dave. I think you're muted, Dave.
Of course, thanks. Creator, we give you thanks for another beautiful day with our loved ones. And as we conduct our work today, you are forever in our hearts and our thoughts. We ask that you give us guidance and love and protection in everything that we do. And please watch over those who mean the most to us.
Thank you, Dave. All right. So I'd like to just do some quick introductions, if I could. So I'll ask Alex and Sarah and then Shai to introduce themselves.
Sure. Hi, everyone. My name is Alex Tran. I am the research coordinator at ReachNexus, and I have the privilege of working on the Positive Actions Initiative. Currently, I'm living in Toronto. I'm also a person living with HIV, and I'm very happy to be here and talk to you all today about this project. And I'll pass it to Sarah.
Hello, everyone. Welcome. It's so nice to be here and to gather with you all today. My name is Sarah Switzer. Pronouns are she, her, and I'm currently a senior researcher at the Center for Community-Based Research. I currently live and work in Takaranto, as covered by Treaty 13, and have been working in the field of HIV on different peer-led projects for some time now. So just really excited to be here with all of you. All right, and I'll pass it. Who do I pass it on to next, Alex?
Right.
Shai.
Hi, my name is Shamali. You can call me Shai. I'm a student from York University working at ReachNexus, and I'll be your tech person for the day.
Great. Thank you, everybody. I'd just like to take a moment, to thank the Public Health Agency of Canada for funding this initiative, and a big shout out to the Center for Community-Based Research for all their support, as well as to our amazing community advisory group. We were fortunate enough to be able to bring together an extremely capable team of community leaders and people living with HIV and academics who helped guide our approach and supported the development of our new Positive Action Development Guide that we're also going to showcase for you today. So let's get started. So I will pass it over to Sarah to kick us off with some housekeeping notes and to lead everyone in a group introduction.
Wonderful. Thank you so much, James. Okay, so just a few housekeeping details for us to kind of keep us organized. So this webinar is going to be recorded. It's recorded now, and it will be made available online afterwards. So for those of you who have colleagues that weren't able to attend, fear not, it will be distributed. We ask that you please ask your questions throughout the webinar. Please ask away, and we will attend to them at the end. So we have a designated Q&A section at the end that we'll moderate. So you can hold on to your questions, or you can use the Q&A feature down below at the bottom of your screen. We've got a handy screenshot there that you can take a look at. So you basically check the Q&A tab to enter your questions. And if you have any trouble at all, don't hesitate to reach out to Shai throughout the webinar, who can support you in getting set up, or even to put questions into the Q&A box if you're encountering any challenges. Closed captioning is enabled, so feel free to turn it on and off as you need to ensure accessibility. And as I mentioned, we've got some tech-related support available for us today. So here's what we're going to be doing today. We started off with an opening, and thank you so much, Dave, for helping us open in a good way. In a moment, we're going to move on to the bulk of today's programming, today's content, which is talking about what positive actions are and why peer leadership is important. Following that, we're going to launch our e-module that we've been working on. I'm so excited to do that and share it with you. And finally, we'll move into kind of the technical details of the funding opportunity that we're launching, how to apply, and we'll be walking you through all of those steps and wrap up with some next steps. And as I mentioned, some dedicated Q&A time. And, you know, because we want to be able to keep this as in a participatory spirit, if possible, we've got some moments of interaction throughout to engage you with. Now, before we jump into one of those moments of interaction, I have a question for all of you. We've got chat enabled. If you toggle down to click everyone in your chat box, and we would love you to introduce yourselves. So tell us, where are you calling in from? You know, you could tell us the city you're calling in from, or the rural area you're coming in from, the territory that you're on. If you need more information, we've got a link in chat, nativeland.ca. You can share the organization you work with if that's relevant, or anything at all. So please say hello. I'll just give a moment for everyone to kind of enter that detail in. Welcome, everyone. Welcome. Oh, this is wonderful. Because we're recording, I won't mention names online, but just to say it's so great to see where folks are calling in from Winnipeg, someone else calling in from Winnipeg, Toronto, covered by Treaty 13, Barrie, Ontario, Alberta, Treaty 6 territory in Edmonton, Montreal, wonderful, Kelowna, BC, fabulous. So many great folks in the room. It's all coming in. Excellent. Welcome, welcome, welcome. So we have chat enabled throughout, so feel free to use it. Say hello and engage with us. Okay. Oops. One sec. Here we go. All right, so we have a question for you. This is our first polling opportunity. As James introduced, this is a project around building positive actions in your community. And so we're curious to hear from all of you. Do you have an anti-stigma positive action in mind already? To answer this question, you can do one of two things. You can pick up your phone and you can scan the QR code. Oh, some of you are already doing it, and enter it in. Yes, maybe, or no. If you can't do it, you can also enter into chat, no problem at all. We can collect the information that way, and you can also join at slido.com using the code. So I'll give you a moment to all start to populate this, and we're seeing it real time. Oh, so we're at 50-50 now. Oh, it's changing, it's shifting. And if any of you are having trouble, you can reach out to Shai as well. And like I said, use the chat if you're struggling. Okay, so wonderful, amazing. So it looks like 50% of you already have a positive action in mind. That's incredible, amazing. 13% of you, not yet, but hopefully maybe by the end of today, we'll give you some inspiration to get you thinking. And 38% of you says maybe. Okay, so let's see if we can slide you over to the yes bucket by the end. All right, fabulous. Thanks all. So we're going to be doing this Slido activity 2 more times throughout today's program. So get ready for that code. And I'm going to pass it over to Alex.
Thank you, Sarah. So positive actions, the what, the why, and the how. So first, I'll speak to what are positive actions. So within this initiative, we use positive actions in place of the term intervention. And so both of these terms can be used interchangeably. You know, they both represent activities that promote health at different levels, and they both address the different factors that impact our health by creating change. And so why have we decided to use positive actions? Well, after discussions with our community advisory committee, we decided to use this term as it fits better with our vision and it more openly inspires strength-based, inclusive, and equitable approaches. And within the Positive Actions Initiative, we're focusing on positive actions with the goal of reducing HIV stigma. And next, I'll speak to our goals of the initiative. And so these goals listed on the screen really explain why we're undergoing the initiative and what we want to accomplish. And so while I go over these goals, I invite everyone here to consider how your positive actions may tie to them and also how they might meet these goals as well. And so our goal is to support positive action teams to implement and evaluate HIV stigma reduction positive actions that aim to accomplish one or more of the following. One, to change attitudes and behaviors to reduce HIV-related stigma where it happens. Two, to change policies and practices that stigmatize people living with HIV in healthcare settings, workplaces, and community organizations. Three, to ensure that people living with HIV can access culturally safe and stigma-free services. Four, to improve the health of people living with HIV. And five, to build the capacity of people living with HIV in becoming stigma reduction champions. And so throughout the next few minutes, we're going to unpack these goals. There are some foundational elements to positive action, such as learning about HIV stigma, peer engagement, and peer leadership. And with that, I will turn it to Dave. Oh, Dave, you're just muted.
Sorry. In order to keep in line with the goals of the project, I think it's important that we define each of three types of stigma commonly experienced. I'm sure as I go through each of these, each of you can relate to a certain one or more of these types of stigma. So first we have enacted stigma. So those are experiences of discrimination, prejudice, or stereotyping because of one's HIV status. So people have physically backed away from me when they learned I have HIV, or I've been hurt by how people reacted to learning I have HIV. And secondly, we have the anticipated stigma. So those are expectations that others will treat you negatively because of your HIV status. So I worry that people may judge me when they learn I have HIV, or I'm very careful who I tell I have HIV. And then to finish off, we'll look at internalized stigma. So endorsement of negative thoughts or beliefs around HIV and applying them to the self. Having HIV makes me feel unclean, or I feel guilty because I have HIV. One of the common ones here for me in the past was the internalized stigma. And I'm going to turn it over to James now. Oh, no, I'm not. I'm sorry. My apologies. We are going to do another exercise here with the slido.com. So Sarah had explained to you in the beginning, you can either scan the code here or go to slido.com and enter the number. And we're asking that, imagine your positive action. What type of HIV stigma would you focus on? And our choices are physical health and stigma, mental health and stigma, accessing health and care, or social relationships and stigma, or all of the above. And people are already, wow, we are cruising with this one here. That's easy. A few people chiming in, but it looks as though 74%, 75% are stating all of the above. Still going up, 78. Very good. Back to 75. All right, and I'm turning it over back to
Me.
Alex.
Thanks, Dave. And thanks everyone for participating in the Slido. So now I just want to talk a bit about peer engagement and peer leadership. And so these two things are vital components to positive actions, especially when looking to reduce HIV stigma. And so in this initiative, we define peers as people living with HIV who are hired into roles where their lived experience is essential to the work. And so one important thing to keep in mind is that peer engagement should always be meaningful and always be purposeful. And so what does this look like? Many of you may know, but some things to keep in mind are to ask peers what their interests are and the skills that they would like to develop, to support peers to take on prominent leadership roles, to involve peers in decision-making processes, and also, so most importantly, avoid tokenizing people living with HIV. And so within working with peers, there are a variety of roles in which peers can be engaged in. Next slide, Sarah. And so, for example, peers can be engaged as committee members. And so committee members can help guide the development of your positive actions. Supporting peers as committee members also gives you access to a group of people who can validate and guide the positive action as well. Peers can also be engaged as team members, such as paid employees in leadership or other staff positions, such as project coordinator, research assistant, just to name a few. But no matter the position, we recommend that peers be financially and equitably compensated for their contributions. Evaluators is another role that peers can be involved as. This can ensure that your positive action is assessing the outcomes that matter most to people living with HIV in ways that are respectful and appropriate. Knowledge sharing activities is another one. Training peers to share information through workshops, webinars, or other creative ways can leverage their skills and also help to build capacity. And most importantly, placing peers at the forefront of these activities centers them in the positive action and ensures that they have a hand throughout the whole life cycle of the project. And now lastly, there are other specialized roles. These roles could be certain things that are required on a temporary basis for a specific skill, such as a graphic designer for branding or marketing consultant for a marketing strategy. And so hiring peers in these specialized roles is really an excellent way to promote the lovely work that is being done by people living with HIV. Now, peer leadership. And so this is a key thing we want to highlight throughout this initiative, is that peers can be and should be supported to be leaders. And so peer leadership is really important because centering peers in leadership positions within your positive action firstly puts JIPA and MEPA into motion. Through peer leadership, we're also able to enhance the capacity of people living with HIV. And one message that I personally resonate with is that leadership does not always have to be at the front. I love this because it promotes the idea that you can learn to lead and that you can develop leadership skills as you grow. And lastly, ensuring principles of equity are considered when supporting and fostering peer leadership is important as well. And with that, I'll turn it over to Sarah for another fun activity.
Thanks, Alex, for taking us through those important points. Okay, so we're about to launch our third Slido activity for this webinar. We are curious to hear from you. Many of you said you already had a positive action in mind, and others of you said maybe you might have a positive action in mind. So we're curious, for those of you who have come to this webinar with some ideas, tell us about them. Do you have a positive action in mind? Tell us about it. Describe the essence of your positive action in 7 words or less. And some examples, if you're stuck, it could be podcasts with people living with HIV, peer-led support. You can share as much or as little as you want. And you're gonna scan the QR code for those of you who've just joined, or go to your browser and type slido.com and enter in the number. And if you're stuck, you can also type into chat. So yeah, we're curious. What are you thinking about? And it's okay if you don't have any ideas too. Living library event. Oh, that's very cool. Peer-led and focused sexual health clinic. Yes. Peer-led programming that increases the capacity of other people with HIV to challenge stigma for themselves and others. Podcast. Yes. Another podcast on Black artists living with HIV. Fabulous. Hiring PHAs. Yes, absolutely. Really thinking about how do we fold folks living with HIV at the center of all of these positive actions, as Alex was talking about. Seminars in schools, peer-led activities, newcomer programs, peer-led self-test distribution program. Okay. Social media campaign. Yes. Create job skills building programs. Fabulous. So as you're seeing these ideas come on, one of the key things that kind of undercuts so many of them is their peer-led approach, which is really fantastic, and that they're really broad. So you can see there's no one-size-fits-all approach here. So there's so many different positive action ideas that you can run with. Peer-led support, letting PHAs lead, PrEP campaign and access for all women, TikTok. Oh, so it says toolkit. I thought it said TikTok. Toolkit for agencies to self-reflect. They have embedded stigma, peer-designed educational model, integrate storytelling, safe spaces and health agencies, working with women living with HIV, more access to testing, self-testing, U equals U initiatives, more peer-led education. Oh, this is fantastic. Okay. Fantastic. Leadership. Yes, 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 yes. So feel free to keep contributing if you want, and you know, also using the chat to weigh in on all of these great ideas. Thanks all. So just to say, there are so many amazing projects out there already, as we've just as we've just seen. And we really wanted to start with your ideas to foreground the many positive action ideas that are already happening in communities, right? We want an initiative to bring all of these ideas into fruition, to amplify so many of the amazing projects that are happening already on the ground, or even already kind of like around kitchen tables, around agency tables, or, you know, in the hearts and minds of many of you. And to know too that there's so many ranges of what's possible. So to kind of keep the inspiration moving, you might want to consider some of the actions on the screen here. There's so many actions that are out there. So one of them is Because She Cares. Because She Cares began as a qualitative research project where African, Caribbean, and Black women were asked about their employment experiences at Canadian aid service organizations. And now the Because She Cares project continues to share stories about ACB community members and allies who work in ASOs in Ontario using poetry and spoken word. You might consider the Speakers Bureau, a program that has been adopted by many aid service organizations globally. And the Speakers Bureau aims to enlighten the public about the realities of living with HIV and to break stigma. This program really kind of dismantles a lot of the stigmas associated with HIV, and they do this by sharing personal stories around HIV. And so speakers are trained in public speaking, and they share their unique experiences in and around the impact of HIV on their lives. And lastly, but certainly not least, you can think about the many, many, many workshops and support groups, many of which are peer-led support groups that ASOs are already rolling out across the coast, right? Bringing together people living with HIV to share knowledge and break HIV stigma. And as Shai has just put into the chat, for more information on these wonderful initiatives, you can check out the links below. And Alex, in a moment, will be sharing our e-module that has even more examples to draw from. So really the key message here is work with so many of the amazing initiatives that are already happening. There are so many already out there, and we really want to amplify so many of these great projects.
Thank you, Sarah. And so for this Positive Actions Initiative, we have developed our e-module titled the HIV Stigma Positive Action Development Guide. And so this e-module was really created to help with the development and implementation of everyone's positive actions. The video that I'm about to share with everyone here will provide a brief description of the e-module and also walk through some fun and interactive elements we have integrated to it as well. So with that, I will just share the video. Hello and welcome to the HIV Stigma Positive Action Development Guide. This module was created by ReachNexus in collaboration with the Center for Community-Based Research, the Digital Education team at Unity Health, and the Positive Action Capacity Building Working Group. This module is designed to act as both a learning module and also a curated resource guide for people living with HIV, positive action teams, and anyone interested in reducing HIV stigma in their community. On the homepage of the module, you will see each of the units listed out, as well as their corresponding lessons. You are able to easily click into each lesson and choose wherever you want to begin. However, we suggest that all new learners start by clicking the Start Course button here. After you click Start Course, you are greeted by this first page here. Here you will see a brief description of the module, some key definitions, as well as some goals. After you have taken the time to read through these, you can click the Let's Begin button below. From there, you'll see the Choose Your Learning Journey page. This module was developed so that you could begin wherever you choose. For example, if you wanted to start at Unit 2, HIV and Stigma, you would just click the Start button here. Alternatively, you can also use the sidebar to navigate throughout the module. You can see each of the units as well as their lessons. And of note, you can also collapse and expand these units as you choose. We've taken the time to try and make this module as engaging as possible. Right now, I'm in the Peer Leadership and Engagement section. As you scroll through, you'll see a variety of texts and images. You'll also see some activities. For example, here we have a sorting card activity. Here, you would read the statement and determine if it was true or false. If you think it was true, you would drag it into that box. If it was false, the other box. Throughout the module, we have scattered things throughout called Listen and Learn. These are audio clips that we think will be beneficial to your learning experience. To play the audio, just click the play button next to the audio player. If you would like to listen to the full episode, those links are hyperlinked in the description. If you would like to download the transcript and read along, those files are also available for download. Throughout this module, we have tried to present information in a fun and interactive way. Right now, I'm in the Developing and Implementing Positive Actions lesson. As you scroll, you'll see some flip cards. To interact with these, just give it a click, and some information will be revealed. Some other things that we've included are these images. So these are interactive images. To access the information, you're going to want to click on the plus icon below and the arrows icon in the corner to cycle through the information. You can also just keep clicking on the plus icons if that's easier for you. Another key navigation piece I would like to go over is what happens when you reach the end of a unit. Right now, I'm at the end of our peer employment unit, Unit 4. If I want to continue to Unit 5, I can just click this bar below and it'll take me straight there. But if I want to go Unit 1, all I have to do is click on this menu button here, and that'll take me back to the Choose Your Learning Journey page. And from here, I can click Start and begin my journey in Unit 1. One last thing I wanted to mention is that if you would like to consult the resources we use to compile this module, you can go to the acknowledgement section, scroll down, and you can download the references document here. If you have any questions, feel free to send an email to this email address listed here. Other than that, I hope you all have a great day, and thank you for watching this video. And so with that video, to access the module, it'll be made available at a later date tomorrow at our website, which Shai has just dropped into the chat I saw. And with that, I will pass it over to James to go over submission and funding guidelines for this initiative.
All righty. Well, thank you, Alex. Let's look at some of the numbers and what we're able to provide. So we are offering, if we just want to flip to the next slide, we are offering 10 one-year grants of up to $20,000 over the course of 3 years. So exactly how many grants we give out per year is somewhat flexible, which is, it's partially dependent on PHAC funding guidelines, but it's also dependent on how many letters of intent we receive, the quality of those submissions, and how much money is requested per positive action. So if we just flip to the next slide, we can look at some timelines and key dates. We've got 5 steps in this timeline. So the first is submitting your letter of intent. So for English applications, the deadline is Friday, November 17th. And for French, it's December 15th. And they're spaced apart like this because we're holding a French language webinar in mid-November, facilitated by Coxita. Now, for those of you who are unsure what an LOI or a letter of intent is, it's basically a document that shows you're interested in applying for the grant, that you'd like to be in the running to submit a full, more fleshed out funding proposal and take part in the positive action process. It also gives us a glimpse into your initial ideas and goals and plans. Now, please use our LOI template, which you can download from the Positive Action webpage on the Positive Effect website. And I believe Shai will put it into the chat, that link into the chat. So all applicants will be notified whether they can move on to the next step and submit a full funding proposal in early January 2024. And those selected will be asked to attend a workshop later in January to learn more about how to develop and submit the full funding proposal. We want to make sure that those who may not be as experienced in submitting a grant feel supported to do so. And the full funding proposals are then due in February 2024. And finally, the teams will be notified if they've been selected as positive action teams in March 2024. I should mention, though, that all teams who submit LOIs or full proposals who are not successful in year 1 or year 2 will be asked if they want, if they'd like to keep their applications in the running for the following year. So let's move on to how to submit your LOI. So the deadline to submit your letter of intent is Friday, November 17th, a little over a month from now. You can submit them to Alex here, and his information is listed. You could download the LOI template, as I mentioned, from the Positive Action webpage on the Positive Effect website, or email Alex directly, and he can send you a copy. And you can also re-experience the magic of this webinar or share the recording from the Positive Action webpage starting tomorrow afternoon. So I'm going to pass it over to Alex now, who's going to quickly walk you through what's in the LOI template.
Thank you, James. So yeah, for the next few minutes, I'm just going to go over the questions that are outlined in our LOI template so that everyone can have an idea of what kind of questions to expect when they're answering. Alrighty. Next slide, please. So question 1, pretty simple. Just please include the team members' names who will be involved in positive action alongside their role and any relevant experience. Number 2 is please list the name of the organization or institution who will hold and administer grant funds if your team is selected. And if there's a specific contact, just please list their name and email, and feel free to reach out to me if you have any questions regarding this. And yeah, we asked this question just to make sure that teams are affiliated with someone who can hold and administer the grant funds. Number 3 is what issue or challenge does your HIV stigma reduction positive action aim to address? Some things to think about when answering this could be, do we want to address stigma and its effect on mental health, social relationships, both, or what type of HIV stigma will your positive action address, internalized, enacted, anticipated? Just a few things to keep in mind. The next point is please provide a brief overview of your positive action, including its main objectives, goals, as well as the project, just a brief description of the project methodology, including how you will incorporate intersectional approaches and the overall feasibility. Number 5 is please outline your peer engagement plan to employ and support people living with HIV in leadership roles within the positive action. Number 6, does your HIV stigma reduction positive action focus on any of the following key populations? And so for this question, there will be a list of key populations for you to select. We encourage teams to explore and address stigma experiences across intersecting identities, for example, across gender, across ethnicity, across different types of lived experiences. and also to consider the unique needs of the key populations. And if the group that you were hoping to address stigma in is not a part of the list, we encourage you to let us know and share in more detail in your letter of intent. And for our last question, so this grant opportunity offers funding in the form of one-year grants with a maximum of $20,000. So just some things to answer, specify the anticipated amount of funding that you're requesting. Is there currently additional funding sources contributing to this positive action? And also, do you intend to apply for other funding to support this positive action? And so for more information regarding the funding overview, funding guidelines, we have a funding overview document, which Shai will drop in the chat briefly. And so this is really just an additional resource to help answer these questions and learn more. This funding overview document is also available on our website alongside the LOI templates. Awesome. And Sarah, I'll turn it to you.
Okay, thank you, Alex. So Alex and James asked me to moderate the Q&A period. I'm going to stop sharing my screen just so that we can take a look at the questions here. So just a moment. And we'll share again at the end to share out next steps. So there's been a few questions that have come in so far that we can turn over to folks at Reach, to Alex and James and perhaps Dave as well. Okay, so the first question, is it possible for an organization to submit more than one LOI?
That's a very good question. I don't see why not. Yes, I think the more the merrier.
Wonderful. Thanks, James. And there's another question about submitting more than one with a bit of a nuance. So I'll ask it just to make sure that we've got all of our bases covered. So for agencies that kind of fold smaller agencies within one, can they still also submit multiple LOIs?
Could you say that again?
Sure. I'll read the question out loud. Our agency is interested in this. We are also the backbone agency, e.g. fund holder / kind of financial holder for other programs. Can there be multiple applications hosted by one agency as long as they are distinct?
Yes, for sure.
Okay. All right, so a few other questions here. Does this mean that each positive action project cannot receive more than 20K over 3 years? Or that they can receive up to 20K per year over a 3-year period, 20K per year?
First answer. So yes, they can only, it's a 1-year grant for up to $20,000. That's my answer.
Okay, and thanks.
If I didn't answer, just just write another question and I'll clarify, or email Alex and we'll get to the bottom of it.
Thanks, all. And perhaps if we're answering your question directly, and we're not quite doing it properly, we're not getting it, also feel free to write into chat and we can revise that way. Webinar is a bit of a funny field, funny tech form. Okay, so a few other questions. Do you need to submit an LOI for each key population if you work with 3 key populations?
No, if the LOI, if the project is working with those 3 key populations at the same time or simultaneously, I suppose. If you're submitting, you could submit 3 separate LOIs if they were different projects. And again, if it didn't answer your question, please put a response into the chat.
All right, thanks, James. Okay. Can the same project receive the grant more than once?
Same project received the grant more than once. I don't think so. And I say that just because I think we need to be equitable across the country.
All right. Let me scan my Q&A box here, and And just to say, others on the Zoom screen, if you want to weigh in, please feel free. Okay. Is the funding available in subsequent years? If successful in year 1, is it possible to, oh, this may have just been answered. Is it possible to reapply for the same funding in year 2 and 3?
Yeah, no, I don't think so. Yeah.
All right. So one year only possibility.
1 year only. Yeah.
Okay. All right. Other questions? So let's see here. Sorry, there's quite a few questions coming in. So if we don't get to your question, please just to note that please email Alex directly. That's not a problem at all. Okay. Can we submit an LOI to support an ongoing project?
Yes, absolutely. Yes, absolutely.
Okay. Great. There's a few questions here about eligible expenses. So what kinds of expenses are eligible and ineligible? So what can it be used for and what can it not be used for?
That's a good question. That I'm not sure I have the answer to right now. I guess I would need an example, I think, to say what it's. Yeah, I'm not sure. If you can give me more detail, or maybe send Alex more detail, we'd be happy to respond.
And there's a question here in the chat. Staffing. Will it cover staffing? Rent?
Yes, I don't see why not. Yes. I mean, probably not if you're an agency, probably not, your program manager's staffing, but that's expense. But whatever's going into the positive action, for sure, staffing.
Right. Okay. So there's also a question about PHAC, the funder, and kind of PHAC's contribution to this project as the funder.
You mean how much money did they? Is that the question?
The question, I think the question is what's the PHAC financial contribution to or commitment, sorry, to the project?
Right. So that was, I think, almost $1 million, but it's spread out over. It's a 5-year grant. So we spent the first year developing, how it should be, how it should look, and how people can participate, and so the funding is then just divided up over 3 years, and the PHAC has it where more of the money is spent in the last year or two, but Reach is helping to supplement that earlier in the first 3 years, so that we could get some equity across over all 5 years. If that makes sense, hopefully.
Thanks, James. And just to say, if folks again have further questions that we're not able to answer in this kind of forum, please feel free to reach out to Alex. Okay. So I'm just gonna give me a moment because I want to make sure I'm gathering all these questions. So there's a question: if folks aren't successful, James and Alex, say they apply in year 1, they don't get it, can people reapply for year 2?
I can take that one. Yes, you are absolutely able to reapply for year 2. There's also a question in our LOI that asks, if you are not successful for this year, would you like to be considered for subsequent years? And when that time comes, we will reach out to you to see if you want to make any edits and adjustments to your LOI. Yeah, so absolutely.
Wonderful. And there's another question about reporting. So say folks are successful and they launch a brilliant, beautiful, positive action. Who do they report to at the end? Do they report to PHAC or do they report to Reach, to this project?
Yeah, so there's a quite a intensive evaluation process with this, and so the Reach would be reporting to PHAC. So the positive action would be reporting to Reach, mostly through the evaluation process. And at the end of the grant, we didn't really mention this, but at the end of the 2027, everybody's going to come together. Reach is going to fund everybody to come together. We'll do a big KTE event at the end so that we can all showcase what we've done and learn from each other and get some big promotion around that.
Thanks, James. So there's a few questions in chat that I want to kind of turn our attention to. There's a question around kind of the detail that folks need to give in, I presume, in the LOI around expenses. Not sure if Alex and James, you can speak to that. Essentially, kind of how much detail they need to give at this particular stage, if I understand it correctly.
So I think this is, I mean, we're not, I don't think we're asking for a budget in the LOI. So, you know, I think it's relatively vague until we get to the full proposal stage. And I should say, if I can just comment on, you know, those LOIs that are chosen to move forward to full proposal, the workshop that we're asking everybody to attend will be, you know, we'll unpack that whole process of, you know, developing a full proposal. So those who aren't really used to that can, you know, we can exchange knowledge and talk about how we can sort of all get on a level playing field to move forward.
All right, thank you. So there's a question here also in the chat about kind of the region in which, or the country rather, that the positive actions are being rolled out in. So I'm going to read the question directly so that I get all the pieces. So we are implementing a project in 7 countries for Indigenous women and girls with HIV about their SRHR. I assume that's speaking to sexual and reproductive health, but if I haven't got the acronym right, please let me know in chat. Can we apply for this funding?
So that's a good question. I think, I mean, if Canada is one of those countries, then yes.
Right, wonderful. Okay. And it sounds like I got a note that one of those countries is indeed Canada. So there we go. All right. So another question here, some notes earlier mentioned a question about existing funding. How is that incorporated into the decision-making process for the applications?
So there's currently a positive action going on that has existing funding. I guess it depends on how, you know, I guess it depends on how you request the money. So I don't think it's a liability. I think that if you have something going on that's really great, we would love to help to, you know, scale that up and support that. So I think that's it's only helpful that it's proven to be a success.
Okay, so thank you so much. We have room for one more question, and then I'm going to turn it back to Alex, I believe, who's going to tell us a little bit about next steps. So this final question for now, again, please feel free to continue to send questions to Alex if you've got more questions you need probing. So there are 2 different dates for the English LOI and the French LOI. Does it mean that there are separate budgets for English and French?
No, it's all one budget. We just wanted to make sure that the French speakers it was accessible to French speakers. So yeah, it's all the same budget.
All right. So thank you everyone for your many questions. And again, if we didn't get to them, please don't hesitate to reach out by email. Okay. And if you do have other questions, maybe keep putting them in chat. And if we have time, you know, before the top of the hour, we can return to them. How does that sound? James and Alex, Dave and Shai? Okay.
All right, thank you, Sarah. So final next steps, just to recap the process. So Sarah, if you would flip to the next slide. Yep, so basically this kind of sums up what we're looking for. So the first deadline being to submit the letter of intent. Following that, attending the full proposal planning workshop. And then following that, you would submit your full proposal. And I also just want to mention that again, there are 2 letter of intent deadlines. The one for November 17th is the English language submission one. The French language submission one will follow after our French version of this webinar, and then the French version of our e-module will also be made available during the French webinar dates. But this is basically it. And if anyone has any questions, feel free to contact me. My email is on the screen. Thank you, everyone who was here today during our webinar. We all really appreciate you taking the time out of your busy days to be here. I know everyone else here looks forward to seeing all the interesting and innovating LOI submissions that we get. And I also just want to mention briefly that after you exit this webinar, there will be a short 3-question feedback survey. Your responses are anonymous, and we appreciate you taking the time to fill it in. And with that, if we don't have any more questions, I hope everyone has a lovely day.